Good morning. Happy Friday, April 3rd, 2026. I'm Mike Berkeley, your favorite reproductive acupuncturist and herbalist, coming to you live from New York City at 7:25 in the morning. But I got inspired. So, I've been treating patients with fertility challenges for about 27 years. I'm the first acupuncturist in the United States of America to specialize in this field. I'm a licensed and board certified acupuncturist, and I'm a board certified herbalist with about 27, 28 years in the field of reproductive challenges, reproductive pathology. And so today I want to talk a little bit about why your IVFs fail, which is not to say that many IVFs don't succeed. In fact, I have something to read to you here. So, under 35 years old, it's about a 50% live birth rate. 35 to 37, 36 to 40% live birth rate. This is all with IVF. 38 to 40 years old, about 23%. 41, about 12%. And over 42, about 4 or 5%, sometimes as low as 1 to 3%. So even if you look at the under 35 category, where there's a 49 to 52% live birth rate, I guess that means there's a 40 something percent or 51% chance of failure. And I guess the question is why? So there are many reasons why, and acupuncture can't necessarily help them. But there are several reasons why where acupuncture and herbs may be the only thing between you and starting or growing your family. So I'm going to talk about those things. What can acupuncture actually help with? So there is a large segment of women who can't get pregnant who are doing IVF. And I say women because I'm just talking about the female reproductive pathology or deficiencies at this minute. And we'll talk about men later. But the bottom line is women either have lining issues, meaning implantation issues, because the lining is too thin, which means 5 millimeters or less, or there's inflammatory issues in the lining like endometritis or endometriosis or adenomyosis. But forgetting all of that, let's just talk about the woman who doesn't have any of that, but she can't get pregnant, and she's 38 years old. Why is it? It's because she has poor egg quality and lower ovarian reserve. So acupuncture has not been proven to increase ovarian reserve, but it's absolutely been proven under multitudinous meta-studies to improve egg quality. And so what do you need to get pregnant? You need a good egg and a good sperm and a good lining and the absence of mitigating disease disorders like polycystic ovarian syndrome or endometriosis, or blood clotting issues called thrombophilic disorders, or immunological mitigators. Assuming you don't have any of those things and it's strictly in egg quality, explore acupuncture. If you're in New York City, I invite you to take a look at our clinic. Our website is berkleycenter.com. It's BERKLEY center.com. If you're not in New York City, go to www.aborm.org. And at that site, you will find a qualified acupuncturist slash herbalist. Qualified in what sense? Qualified in the sense that they have expertise in reproductive pathology and reproductive physiology and how to treat those with reproductive disorders. Now, let's briefly talk about men. So, men can have low sperm count, poor morphology, the shape, poor motility, which is the inability of the sperm to swim in a straight line, or something called sperm DNA fragmentation, which is never tested for by your reproductive endocrinologist. Ask me why, and I'll have no answer. As far as I'm concerned, semen analyses are incomplete because they don't include the sperm DNA fragmentation assay. Every male patient that I have who's over 38 years old will get that test. 0 to 15% DNA fragmentation are good fertility outcomes. 15 to 29% are good to fair, and above 29% there's no pregnancies. Now, what the reproductive endocrinologist will say is one of the reasons with sperm DNA fragmentation, or one of the reasons that sperm DNA fragmentation causes infertility or contributes to it, is that it can't penetrate the egg. Well, we overcome that with ICSI, intracytoplasmic sperm injection, where we inject the sperm into the egg, and now we've got an embryo. I put to you for your consideration that if you inject a bad sperm into a good egg, you're going to get poor embryo quality. And by the way, when you test your embryo with PGTA or PGTM, either for genetic anomalies or chromosomal anomalies, and the embryo comes back totally normal and you transfer it, why didn't it work? Assuming you don't have any inflammatory proteins or blood clotting issues, why did they transfer a good embryo, chromosomally normal embryo, genetically normal embryo, and it didn't work? Well, I'll tell you why. Because there's more to a good embryo than just its chromosomal or genetic makeup. And so don't be fooled. How many people watching this video have had a transfer of a perfect embryo or a really good embryo, and you got pregnant and had a chemical pregnancy, or you didn't get pregnant at all? Consider using acupuncture and herbs. They've been used for about 2,500 years to treat fertility challenges. Find yourself an expert in this field. Just imagine, I've been doing this for 28 years, never treated a back, never treated a neck, never treated a knee, never treated an elbow. For 28 years, I've spent a quarter of my life helping people to get pregnant. So this is not a sales pitch. I'm not telling you this to have my phone ring off the hook, no matter what you think. I'm telling you this because I've devoted my life to helping people. I went through this. I went through infertility with my wife. And do you know what saved us? Do you know what got me my 31-year-old? Acupuncture and herbs. I was a computer salesman. I thought acupuncture was all BS. Now I have a 31-year-old son at home. So I devoted my life to this form of medicine, and I devoted my life to this field of medicine. And so if you're in New York City and you're sick and tired of failed IVFs and going to see your antral follicle count and going to check your estrogen levels and going to see how your progesterone levels are, etc., 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 going to see how thick your lining is, all the stuff they do, and you still don't get pregnant, then call me if you're in New York City and let me help you get pregnant. My website is www.berkleycenter.com, BERKLEY center.com. And if you're out of New York City, visit www.aborm.org, the American Board of Oriental Reproductive Medicine. I am here for you, but I don't know how to reach you. But you know how to reach me. So if you want help, then call me. And by the way, even if you're not in New York City, if you want an herbal medicine consult or an acupuncture consult, I don't care if you're in Indiana or India, I can do it, and I can design the proper acupuncture protocol for your acupuncturist to use. So even if you can't find a reproductive acupuncturist, even if your acupuncturist just does neck and back pain, I can come up with the proper acupuncture protocol based on my evaluation and intake with you, and then email it to you, and you can give it to your acupuncturist. I can compose a customized herbal formula specifically for your case and for you as a person. I never did get to talk much about men, so I'll spend a few minutes about men. Men that have low sperm count, poor morphology, poor motility, or sperm DNA fragmentation will have a difficult time getting their woman pregnant. IVF can certainly overcome these things. However, uh, if the case is only male factor, then why would you spend 25 grand on an IVF when you can spend, a couple $1,000s on acupuncture and have your sperm improved? If you have a major varicocele, if you have a missing vas deferens, uh, if you've had radio chemotherapy on your testes, uh, there acupuncture is not going to help you. You have to use donor sperm. But there are many millions of men that have poor sperm parameters without having these physical issues, uh, an enlarged vas or a missing vas or a varicocele. They don't have these things. They just have idiopathic sperm problems. Idiopathic means no known cause. Acupuncture is extremely efficient at normalizing or helping to normalize sperm parameters. I have nothing else to say at this point except I wish you Godspeed on your journey to family. I'm here to help if you'd like to take advantage of that. I look forward to hearing from you and to working with you. All the best. Have a great weekend. Bye bye.